Атырауская областная больница.
The Atyrau Regional Hospital provides emergency medical care to the population of the region, provides high-quality medical services. The hospital today can provide inpatient care for up to 400 people at the same time. Few people know that for the past 12 years, NCOC has been implementing a special project with the participation of foreign medical experts. The project helps to improve the quality of emergency medical care for the population of Atyrau region. This project aims to improve the emergency medical care at the Atyrau Hospital. Here we are in the transition to the heart of our hospital, the operating unit and the intensive care unit. For a long time, patients from Atyrau region traveled to Republican hospitals in order to receive highly specialized medical treatment. Now, thanks to NCOC project, many patients from Atyrau region have the opportunity to receive complex types of treatment and, most importantly, emergency care here in this hospital.
Dr. Hendrik, вот сейчас мы наблюдаем...
Dr. Hendrik, just now we saw you take part in the operation. Please tell us, what operations do you take part in and what cases from your work in Atyrau do you remember the most?
The operations I'm mainly involved in are the more complicated operations. Very often emergency operations where patients come in very ill, and at surgery we find that they have or a perforated bowel, so perforation of the bowel, or a obstruction or blockage of the bowel, or they have a severe life-threatening bleeding from the stomach or from the duodenum. By assisting and scrubbing in with the Atyrau surgeons, we together decide what the best ways of treating that particular patient. And obviously the main aim is here to save the patient's life. And by discussing some of the techniques which we use in the United Kingdom and some of the techniques available here, we very often come then to the best outcome, what we think is the best way of treating that patient. We work always together, so there's never on our own. We work with surgeons together and try to work out what is the best for the patient. And as I say, the most important aim for us is trying to get the patient out of trouble and save their lives.
In addition to support in the emergency care, there were numerous consultations, seminars and training lectures held within the framework of the project. International standards for the provision of emergency medical care are being implemented in accordance with the standards of the American Heart Association, COSASA standards, and the guidelines of British associations such as NICE and SIGN. I think that the effect of this project is significant. The population of the Atyrau region is of great benefit. There is a professional exchange between international doctors and doctors of Atyrau region. We believe that the goals of the project are being achieved, and the project has proved itself effective.
Dr.
Dancho, you spend a lot of time training local experts. How does new knowledge help them in their work?
Thanks for the question. So the main two areas where I'm helping with the local doctors is the first one is the teaching, training and simulation training, and the second one is the clinical area of expertise. So we know that the medical knowledge is changing every 75 days. So I established a very well organized teaching program, which is every Monday during the week. So I'm teaching the doctors on Mondays, nurses I'm teaching in the rest of the week. So the main skills our doctors receive were in doing regional blocks. That's the supraclavicular block, and it's been widely used currently in the department for anesthetizing patients. So this block is excellent for pain relief. This is a very good block for pain relief after the surgery. We also introduce here the use of the laryngeal mask airway, which is actually less traumatic than the endotracheal intubation, and the department now is using the LMA very widely. Apart of that, I tried everything to standardize the clinical management of the patients in the ITU, and I think that with Dr. Henk we brought a lot of improvements, and we are working not only for the doctors here but for the citizens of the Atyrau.
В рамках проекта
As part of the project, NCOC also provides the clinic with modern equipment. Today it is installed in the emergency room, in the operating unit, and in the intensive care unit, where a person's life sometimes hangs in the balance. The equipment is serviced 24 hours by qualified expert of this project. I have often visited the regional hospital before, and I noticed that the equipment has changed a lot.
В последнее время у нас обновлено оборудование. Это
Yes, the equipment was upgraded as part of the project. Anesthesia equipment for the intensive care unit, lung ventilators, plus the equipment that we have in the intensive care unit, defibrillators, monitors, and ALV equipment. The equipment in the operating rooms was also updated. X-ray machines, operating lamps and tables, microscopic equipment. I have been working in this project since 2011, and due to the fact that the equipment is serviced on time, it has been working flawlessly. We provide equipment maintenance 24/7. Faster repair options and fast procurement of needed parts are all thanks to the NCOC project.
бұл проекті жалпы біздің дәрігер.
The project is aimed at improving the skills of our doctors and improving the technical capabilities of the hospital. All foreign doctors who came to the project from the UK, the Netherlands and France in different years have helped us improve the quality of medical services for our population, apply new methods of treatment. Trainings are especially valuable for young professionals. Foreign experts help us, and together with our doctors, take part in planned and emergency operations.
Очень большое спасибо за...
I appreciate the experience and opportunity to exchange experiences and listen to foreign doctors who work side by side with us and advise in difficult cases. We learn from them about advanced technologies and treatment protocols practiced in Europe, Western countries, America. We also learn through them how to respond in various non-standard situations.
Используемые в Европе, в западных странах.
This is just one success story. For the past 12 years, a pleiad of young specialists has grown using the opportunity to study international standards right here, within the walls of the hospital, without leaving their workplace. NCOC provided even more support during the pandemic by building new modular-type hospitals in the cities of Atyrau and Atyrau, and providing several hospitals with vital medical equipment.
в этом году исполняется
This year marks 30 years since the signing of an agreement on the establishment of the Consortium for Research and Development of the largest Caspian field. We have seen the ambitious construction of offshore islands, onshore complex, large-scale infrastructure for offshore operations, and the start of Caspian oil production. And there were hundreds of the most demanded social projects implemented for the community. Most importantly, NCOC's activities to develop infrastructure in the two regions continue. This means there will be new schools and kindergartens, gas pipelines and cultural centers, and many other objects that people need, and we will certainly share about them.
о чем мы непременно расскажем.